Caffey disease, also called infantile cortical hyperostosis, is a rare condition that makes the outer layer of some bones grow too thick. It usually appears in babies under 6 months old. Think of it like a baby's jawbone, getting a hard shell that makes the face look swollen and painful. Most cases happen without a clear reason, but two main causes are known: a genetic change, often a mutation in the COL1101 gene that runs in families, and sometimes an infection or a mild injury that triggers the bone reaction. Imagine a tiny switch in the body's blueprint that sometimes flips on its own, or after a small scratch. The typical signs are a painful firm swelling of the jaw that makes the baby cry while feeding, low-grade fever, irritability, and in some kids, swollen ribs or long bones that feel hard to the touch. Picture a baby who suddenly refuses to eat because the lower jaw feels like a sore toothache. Doctors look at X-ray pictures that show the bone's outer layer thickening like a double wall. Blood tests often show a high inflammatory marker, ESR. Treatment focuses on easing pain. NSAID medicines such as ibuprofen are common, and steroids are used if the swelling is severe. In very rare cases where bone growth blocks breathing, surgery may be needed. Think of it as calming a fever with medicine while watching the bones slowly return to normal. Because the exact trigger is not always known, there is no surefire way to stop it from happening. Parents can help by seeking medical care early if they notice unusual jaw swelling. And families with a known genetic mutation may consider genetic counseling before having more children. Simple steps like avoiding hard biting toys for the infant can reduce extra stress on the jaw. Recent studies have confirmed the COL1101 mutation in many families and are testing newer drugs called bisphosphonates, which slow bone overgrowth. Small clinical trials suggest these medicines may reduce swelling faster than steroids alone. Researchers are also using DNA sequencing to find other genes that might participate